Crisis intervention. Introduction. Stressful situation is a part of everyday life. Any stressful situation can be precipitated a crisis. Crises result in a disequilibrium from which many individuals require assistance to recover from this stressful situation. Crisis intervention requires problem-solving skills that are often diminished by the level of anxiety. Whenever the person is having a lot of tensions and anxiety, they forget how to tackle with the stressful situations. Accompanying disequilibrium, assistance with the problem solving during the crisis period preserves self-esteem and promotes growth with the resolutions. Definitions of crisis. Crisis is defined as a sudden event in one's life that disturbs homeostasis during which usual coping mechanism cannot resolve the problem. A crisis is a turning point in an individual's life that produces an overwhelming emotional responses of an individual's experiences crisis, which they comfort some crisis circumstances or stressors that they cannot effectively manage through the use of their customary coping skills that they use. A number of characteristics have been identified that can be viewed as assumptions upon which the concept of crisis is based, is given in 1998 by Kaplan, in 1964 and Winston 2008. They include the followings. First one is, crisis occurs in all the individuals at one time or another and is not necessarily equated with the psychopathology. It can be come to anybody, anywhere, in any situation. Crisis is precipitated by a specific identifiable event that occur in own individual life one by one. Third one is, crisis is personal by nature. What may be considered a crisis situation by one individual may not be so far another. Fourth one, crisis is acute, not chronic, and will resolve in one way from another within a brief period. Fifth one, a crisis situation contains the potential from psychological growth or deteriorations. Now, OCD. How we can connect crisis with the OCD? Introduction. Obsessive compulsive disorder is a disorder in which people have reoccurring unwanted thoughts, ideas, or sensation is called obsession. That ideas that make them feel drive to do something repetitively in a practice is called compulsion. Obsession. Unwanted, intrusive, persistent ideas, thoughts, impulses, or images that cause marked anxiety or distress. The most common one include repetitive thoughts about the contamination, repetitive doubt on anything, a need to have things in a particular order and a systematic way, aggressive or horrific impulses, and a sexual imaginary. Compulsion. Unwanted repetitive behavior, patterns or mental act, example, praying, counting, repeating words silently that are intended to reduce anxiety, not to provide pleasure or gratification, is given by APA in 2000. They may be performed in response to an obsession or in a stereotype fashion. Obsessive compulsive disorder is characterized by unreasonable thoughts and fears like obsessions that led to a compulsive behavior. Thoughts imposes to do a behavior. OCD often centers on the themes such as a fear of germs or the need to arrange objects in a specific manner. The most common compulsion involves washing and cleaning, counting, checking, requesting or demanding assurance, repeated actions and ordering. Now, stimulus. that is given from the external or internal force that creates a distress and anxiety in an individual, or obsession thoughts, or repetitive thoughts. Then it can be ritualized by the behavior of a person and temporary relief from the distress and anxiety by the help of reinforcement of a behavior. Synonym symptoms. First one is obsessional thoughts, word, ideas and beliefs that intrude forcibly into patient's mind. Second one is obsessional images, vividly imaged scenes, often a violently sexual practices. Third one is obsessional ruminations, compulsively focused attention on a symptoms. Obsessional doubts, forgetting to turn off the stove or not locking a door. Obsessional compulsion impulses, violently or embracing kind such as injuries, a child shouting in a church. Symptoms of compulsions: washing and cleaning, example excessive hand washing or house cleaning. Counting, example counting number of times that something is done. Checking, example checking something that one has done over and over again. Requesting or demanding assurance from others. Repeated actions, example going in and out of the door or up and down from the chair. Ordering, example arranging or rearranging the clothes or other items. Synonym symptoms of an individual in crisis. It is not related to OCD but the normal person in a crisis. Emotional reactions: fear, anger, guilt, grief. Mental reaction: difficulty in concentration, confusion, nightmares. Physical reactions: headache, dizziness, fatigue and stomach problems. Behavior reaction: sleep and appetite problems, isolation, restlessness. Risk assessment: recurrent and persistent thought impulses or images that are experienced at some time during the disturbance as intrusive and inappropriate, and that can cause marked anxiety in a person. The thoughts, impulses or images are not simply excessive worries about real life. Third one is the person attempts to ignore or suppress such thoughts or to neutralize them with some other thoughts or actions. Fourth one is the person recognizes that the obsessional thoughts, impulses or images are a product of his or her own mind. Fifth one is repetitive behavior, example hand washing, ordering, checking or mental acts, example praying, counting, repeating words silently, that the person feels driven to perform the response to an obsessional thought. The behavior or mental acts are aimed at preventing or reducing distress. Crisis intervention. First one is definition of a crisis intervention, that is, crisis intervention is defined as a technique used to help an individual or family to understand and cope with the intense feelings that are typically of crisis. Resolutions ends in a positive or negative outcomes. Crisis intervention aimed at a positive outcome, that is, procedures for crisis intervention. How to perform a procedure. To provide a correct cognitive perception, assessment of a situation is the first and foremost important thing to do with a crisis individual. First one is purpose for the identification of a problem. Second one is to identify the support system available. Third one is to identify the strength and limitation of a victim or a person. Procedure for crisis intervention. First, define the events or a situation that happened to an individual. Second one is to bring the precipitating events to awareness of a victim. We have to put the person into awareness of that situation again. Plan of action. Victim and people should have active involvement in developing a plan of action. Guidance to a victim should be given. Instructions and support care to provide for victim by the therapist is the important thing. Procedure for crisis intervention continue to assist the individual in managing the feelings. First one is help the individual to be aware of the feelings, help the individual to attain mastery over the feeling of an individual. Now, next one is techniques of crisis treatment. that is given by Jackson, Stickle and Morelli in 1968 and Morelli in 1970, have discussed different techniques of crisis intervention for a person. First one is environmental manipulation. It includes intervention that directly change the patient's physical or interpersonal situations. These interventions may remove stress or provide situational support to a person. For example, a patient having difficulty in his job may take a week of a sick leave so that he can be removed temporarily from the stressor or can be escaped from the stressor. General support. It consists basically of an active listening in a non-threatening manner, allowing the person to speak in some detail about his problem without challenging him. Third one is generic approach. The generic approach is designed to reach high-risk individuals and large groups as quickly as possible. It applies a specific method to all the individuals faced with a similar type of crisis. Example, in social disaster, defragging is a method of a generic approach. It includes in a generic approach. In defragging method, disaster victims are helped to recall events and clarify traumatic experience. It attempts to place the traumatic event in a perspective, allows the individual to relive the event in a factual way, encouraging group support, and provides information on normal reaction to the critical events. The goal of defragging is to prevent maladaptive responses that may result if the trauma is suppressed over a long period of time. Fourth one is individual approach. The individual approach is a type of crisis intervention similarly to the diagnosis and treatment of a specific problem in a specific patient. It is particularly useful in a combined situational and maturational crisis, and also beneficially when the symptoms include homicidal or the suicidal risk for the patients. The nurses must use the intervention that is most likely to help the patient develop an adaptive response to the crisis. Techniques of crisis intervention. First one is catharsis. The release of feelings that taking place as a patient talks about emotionally charged area. Clarification. Encouraging the patient to express more clearly the relationship between certain events. Manipulation. Using the patient's emotions, wishes or values to benefit the patient in the therapeutic process. Reinforcement of a behavior. Giving the patient positive reinforcement to adaptive behavior. Support of defenses. Encouraging the use of healthy, adaptive and defensive and discouraging those that are unhealthy and maladaptive thoughts and the environment. Increasing self-esteem, helping the patient to regain feeling of self-worth that he or she is very important. Exploration of solution, examining alternative ways of solving the immediate problem. Management with OCD. Now first is individual psychotherapy. The psychotherapist also can use logical and rational explanation to increase the client's understanding about various situations that create anxiety in his or her life. Psychoeducation information may also be presented in individual psychotherapy. Second one is cognitive therapy. Cognitive therapy for anxiety is brief and time limited, usually lasting from 5 to 20 sessions. Brief therapy discourages the client's dependency on the therapist, which is prevalent in anxiety disorders, and encourages the client's self-sufficiency. Third one is cognitive behavior therapy. It includes cognitive as well as behavior. First one is cognitive. Change the way they think to deal with their fears. Behavior. Change the way they react to anxiety provoking situations. Exposure and response prevention. slowly learning to tolerate anxiety associated with not performing ritual behavior. Fourth one is psychotherapy. Talking with a therapist to discover what caused the anxiety and how to deal with the symptoms. Systematic desensitization, learning cognitive strategies to deal with anxiety, then gradual exposure to fear about objects should be done when the people are ready for it. It's not must be customized for each person's specifically form of OCD and their needs. Not same for every person, but according to their disease condition, it should be prioritized. Home based management. Client is advised to use relaxation and thought stopping technique whenever he gets anxious. Second one is patient is advised to talk with the friends and family members related to the inbuilt anxieties or maintain a personal diary to express out the emotions. He is encouraged to share his feelings, improves the self-care needs, for example, personal hygiene independently, and tell about sleep hygiene techniques to a patient. Instruct to use relaxation techniques such as mindfulness, meditation, or deep breathing when getting aggressive. Taught about the positive coping methods to a patient, take medication on a time and never misses the dose. Patient and his family members is advised not to stop or alter the dose of a medication without consulting doctor. Prevention of OCD, obsessive compulsive disorder treatment may not result in the cure, but it can help bringing symptoms under control of a patient so that they don't rule your daily life. Depending on the severity of OCD, some people may need long-term ongoing or more intensive treatment for the disease. Role of nurse in crisis management with OCD, that is assessment, planning, implementation and evaluation. So first is assessment. In this phase, the crisis helper gather information regarding the precipitating stressor and the resulting crisis that promoted the individual to seek professional. A nurse in a crisis intervention performs some of the following assessment. First one is ask the individual to describe the event that precipitate these crises. Second one is determine whether it occurred. Third one is determine if individual has experienced the stressor before. If so, what are the coping mechanisms used? Have this method tried this time? If previous coping methods were tried, what was the result? Assess the adequacy of support system. Information from the comprehensive assessment and then analyzed and appropriate nursing diagnosis reflecting the immediacy of crisis situation are identified. Some of the nursing diagnoses that may be relevant including the following: risk for self or other directed violence, ineffective coping, anxiety, disturbed thought procedure, fear, disturbed sleep pattern, hopelessness, powerlessness and worthlessness. Second one is planning of therapeutic intervention, that is phase 2. In planning phase of crisis intervention, the nurses select the appropriate nursing actions for the identified nurse's diagnosis. In planning the intervention, the type of crisis as well as the individual strength and available resources for support are taken into consideration. Goals are established for crisis resolution and a result to or increase in the previous crisis level of functioning. Third one is implementation. Use a reality oriented approach with the patient. The focus of approach is on the here. Remain with the individual who is experiences panic anxiety. Establish a rapid working relationship by showing unconditional acceptance, by active listening and by attending to immediate needs of the client. Set firm limitations on aggressive, destructive behaviors. At high level of anxiety, behavior is likely to be impulsive and regressive. Establish At the onset, what is acceptable and what is not. Acknowledge feelings of anger, guilt, helplessness, and powerlessness, while taking care not to provide positive feedback for these feelings. Guide the individual through a problem solving process. Fourth one is evaluation. To evaluate the outcome of crisis intervention, a reassessment is made to determine if the stated objectives were achieved. Have positive behavior changes occurred? Has the individual developed more adaptive coping strategies? Have they been effective or not? Have the individual grown from the experiences by gaining insight his or her responses to the crisis situation or not? Does the individual that he or she could respond with a healthy adaptation in a future stressful situation to provide crisis development? Last one is, can the individual describe a plan of action for dealing with the stressors similarly to the one that precipitated the crisis? Thank you.